nurse today. Can I please get your name and birth date? Hello, do you have any allergies, specifically iodine or latex? I would verify the band, verify the name and birth date. Perfect. Well, like I said, my name is Anna. I'm going to be inserting a Foley catheter today. This will be a tube that goes into your urethra and will voluntarily empty your bladder. You're just not urinating as much as we'd like to. We think this might be a better fit. Do you have any questions for me? Won't be painful. You'll feel a little bit of pressure when I'm inserting it. But after that, you should not feel anything. Grab gloves. Assist my patient into supine position. I'm going to clean you up here quick and do some peri-cares. I have warm soapy water. If they're not able to do it themselves, I will do it. And I will clean them outside, outside, inside, inside, and once right down the middle. Discarding to this towel, I have a clean dry towel. I'll clean it in the same, or dry it in the same fashion. Outside, outside, inside, inside, and right down the middle. Discarding my gloves. Wash my hands. I'm going to verify my order. Today we are putting in a Foley catheter. I'm going to open my tray in a sterile fashion. I'll first open away from me, sides, sides, and towards me. All just touching the inch border of my sterile field. I will grab the corner of my tray here. Just touching again an inch. And I will place it right below my patient, utilizing it as a sterile field. I will then grab my gloves, just grabbing the edges. I'll grab the inside of the gloves. And again, grabbing the inside, scooping my hand into the glove. And I will get rid of this. Okay. And discarding of the drape. And take off the top tray, keeping it within my sterile field. Scribbing the iodine, pouring it over the cotton swabs, discarding of that. Grabbing my tube. Dipping it into some lubricant. And placing it on my tray. And connecting my sterile saline to my catheter as well. I'll then place my tray on top of my other tray, bringing it to the sterile field in front of the patient. I will grab an iodine-soaked cotton swab. With my non-dominant hand, I will grab the genital area and I will wipe the outside, drop, outside, drop, inside, drop, inside, drop, and right down the middle. stopping. I will then grab my tube, or my tube. I'll have the patient bear down for me, and I will insert until I see urine. Once I see urine, I'll still push in about 1/2 inch, and then I will release the balloon and put in my sterile water. Then I will tug and see if get some resistance. Then I will remove my sterile gloves into the garbage. I will wash my hands. Another set of clean gloves. At this time, I'll disconnect the saline tube. I will attach the bag to a non-movable part of the bed, making sure there are no loops in my tubing. And at this time, I would also connect the leg strap to the leg, making sure that the catheter stays in place. I do not have one right now, but that's what I would do. I would gather my supplies here. Put our legs back down. I'll grab my other basin of warm water and do pericares again. Outside, outside, inside, inside, right down the middle, and then 2 to 3 inches down the tube, making sure that is clean. I'll then grab another clean dry towel and dry it in the same fashion. Outside, outside, inside, inside, down the middle, and 2 to 3 inches down the tube. I'll remove my gloves. Make sure the patient is in a comfortable position. Put their call light within reach. Ask if they have any questions, if I can get them anything while I'm in the room. Again, my name is Anna. I'll be your nurse until 7. Please don't hesitate to call me or if you have any questions or concerns. I will declutter the room. Again, call lights within reach. They have a fresh water pitcher. They're comfortable. I would go and document the time, initials, type of catheter, length of catheter, how much urine I noticed, color of urine, and if the patient showed any resistance. And I would date as well.